We've been talking about age and its impact on different aspects of sexual and prostate health. For example, we talked about enlarged prostate and how that influences sexual behavior. This week, we're going to talk about how testosterone or age influence testosterone and subsequently libido. So in order to measure the impacts of libido on sex, one can biochemically measure testosterone, especially in men, because we also measure testosterone level in women. However, the easiest way to do it is to actually look at frequency of sexual activities. As we all know, when we're much younger, we are a lot more driven and have a higher libido. As we get older, that libido actually decreases. Exactly how low does it get when you get older? In fact, there are many studies that actually identify that. In Malaysia, we were part of a study, a bigger study called AP287, which is Asia Pacific Sexual Health and Overall Wellness Study. This is out of 13 countries, and Malaysia participated in this study, actually highlighted that below the age of 40, perhaps all the couples are engaging in sexual activity about twice a week. However, beyond the age of 40, perhaps once every 5 days. That translates to about 4 to actually 6 times per month. But we all know that sexual intercourse is dependent on many other factors. For example, physical factors and also social factors and cultural factors. Physical factors actually dependent on your testosterone level and also your overall fitness. For someone who's generally energetic and physically fit, obviously sexual activity is more frequent. However, if somebody has got diabetes, non-communicable diseases and high blood pressure and also on medication, sexual frequency is reduced. The second thing that it dependent on is actually on emotional or sociological factors. For example, as we get older, you get bolder, fatter, wrinklier, and that itself has a self-image implication. And also, if partners is not so keen on sexual activity due to work commitment, for example, in Japan that's reported, and sexual activity will decrease. Lastly, cultural. So in certain culture, actually considering having sex at older age is perhaps something that is of a stigma. However, in the USA, it is actually highlighted that in advancing age, so even for more senior couples, the sexual frequency is actually not as low as you think. For example, Kinsey, the institute actually highlighted that at the age of 65 to 74, the frequency of sex is as high as 40%, and also beyond the age of 75, it can be as high as 27%. So do not underestimate the age itself may be a dampening effect on libido. For the following week, we want to talk about how age can influence your hair. If you're worried about that, stay tuned for next week's Putting Dr. G on the Spot.